name's Shumway, and today for our visit I thought we would give you a tour of our office. I work here with my son, Dr. Joel Shumway, and we have a staff of about 12 people who help in the dentist process of serving our patients. So we are currently standing in our waiting room where people come, and hopefully just a short time they spend in the waiting room until we're able to get them back into the treatment room. I'd like to introduce you to Gaston. Every day we cook fresh baked cookies that help smell the office with delightful smells as well as it tastes pretty good. And over here we have a frozen yogurt ice cream machine where we serve soft serve ice cream as a treat for our patients before and after their appointment. This is one of our hygiene rooms where people get their teeth cleaned and where we do conservative gum treatments. We have digital x-rays that take about 1/10 of the normal radiation when we take the x-rays. We have ultrasonic scalers that help clean the plaque and tartar off of the teeth in a very comfortable manner with a fine water mist. We have 4 hygienists currently working in our office. Some are full-time, some are part-time. I'm partial to them. I think they're great hygienists and they will serve you very, very well. This is the area of the office where we sterilize. We have 2 state-of-the-art sterilizers to completely clean and sterilize our instruments. We have a special dishwasher over here that we put the instruments in as well before we sterilize them to clean all the junk off of the instruments. I don't know if that's a technical term, junk, but we get them cleaned first in the dishwasher and then we sterilize them. And then we store supplies and instruments in this area. This is part of our Sarek system. Sarek is a method where we can do same-day crowns. This is a special computer where we scan your tooth into the computer and we design the crown and then the computer runs a special milling unit, and out of a block of porcelain it will mill the crown to specific specifications for that particular tooth. It fits well, looks great, should last many, many years. That's the Sarek machine. Example of one of the doctor operatories or treatment rooms. This is where we do fillings, we do crown and bridge work, we do lumineers, we do extractions, we do root canals. The Sarek machine can be wheeled into any room. We have lasers to help with soft tissue treatments that we bring into each of the room. If we need to do root canals or extractions, everything is compartmentalized to where it's very efficient. We bring what we need into this room. Each room is pretty much identical. Each room is equipped with digital x-rays that just take seconds to process instead of waiting 5 or 7 minutes to develop the standard x-ray. We have special cushions on the chair made of Tempur-Pedic material. This helps for longer appointments to add a little bit of comfort to the patient. And so, you know, somebody may be in this room for just a few minutes while we do a simple filling, or they could be here for a few hours as we do treatment. We got these special pads when we began to do sedation dentistry, and people may be in the office for 4 or 5 or 6 hours being sedated while we did many procedures on that individual. And we liked the pad so much, we got so many compliments that we got one for each room, even for the small appointments that we do. Also, when we built the office, we included overhead monitors where we can show our patients their x-rays or pictures of their teeth. But that doesn't take very long. During the course of the appointment we may have the TV on, or we have an extensive library of movies on the computer that we can run on the monitor, and put wireless headphones so that they can watch and listen to the movie and literally be entertained while we're working on their teeth. This is the other part of the Sarek unit. This is the milling unit that actually will take a block of porcelain and mill it to our specifications to fit the tooth exactly. And it comes in different colors. We are currently doing Emax crowns, which is a very hard porcelain. We mill the crown in the unit here, and then we take it into a special firing oven where we glaze the porcelain, and it actually makes it stronger. A Sarek crown may take about an hour and a half in the office, but it saves another visit, and it saves the need for wearing a temporary crown for a period of 2 or 3 weeks. It's a wonderful procedure. So we're in the hallway right now. We have 5 treatment rooms for the dentist to work out of, and we have 4 hygiene rooms. So we're able to see many people and work on them, and we try to have a family atmosphere. We see children, we see adults, we see patients with special needs, and our goal is to have them walk out of the office and say, you know, it wasn't that bad. Not that anyone really likes going to the dentist, but if they can walk out and say that they had a pleasant experience and it wasn't that bad, I think we've accomplished quite a bit. One other room I'd like to show you, this is our Panoramic XRay room. This is a digital panoramic X-ray. Again, it takes a lot less radiation than the standard panoramic X-ray that takes film. A panoramic X-ray is one that goes from ear to ear. We see the entire lower face and all of the teeth. If people have impacted wisdom teeth, we're able to see these X-rays on this panoramic X-ray. We're able to see parts of the jaw, the upper and lower jaw, that we're unable to see on the little tiny X-rays that go inside of the mouth. This is a great help for our diagnosis procedures and in helping patients maintain good optimal dental health. Well, another piece of technology that we have for our patients is called the Velscope. This is a special light that is a green light, and it fluoresces the inside of the oral cavity. If there is a suspected area of soft tissue within the mouth, it will show up as dark. You know, it doesn't mean that you have cancer and that it's a serious situation, but it shows abnormal tissue, and it may alert the dentist to go further into diagnosing what that darkness might be. You know, fortunately, most of the time it is something that we don't have to worry about, but those rare instances where it may be oral cancer, it's a special way for us to detect it earlier and get it treated earlier. So this is the Velscope. So this has been a tour of our office. You've seen most of it, and we've explained a little bit of what we do and the equipment and the tools that we have to help provide dentistry in a very comfortable environment and in as painless of a manner that we possibly can. I hope that you've enjoyed the tour. If you have any questions or would like to come visit our office, please call us, and we'd be happy to show you around and give you a personal tour. Thank you so much.